As president of the World Tourism Network, it gives me great pleasure to greet your guests. As you guests might know, the World Tourism Network is dedicated to helping small and medium-sized tourism enterprises succeed. We offer a great range of options to our members, and I strongly recommend that each person here this evening become a World Tourism Network member. Madam Astuti will be pleased to provide each of you with membership information. A few months ago, I had the honor of visiting the beautiful island of Bali. It was my first time in Indonesia, and I must say that I was impressed by the graciousness of your people and the tranquility of the Bali once one leaves the hustle and bustle of its large city. I certainly hope to return in the near future and learn more about the culture of your beautiful land. The topic for this evening is medical tourism. I have had a good deal of experience in this form of tourism, especially in Mexico, which is one of the world's leaders both in medical and dental tourism. I would be remiss in not telling you that there is a great deal of competition in this field. To success, you need more than great doctors, good facilities, and gentle smiles. Successful medical tourism requires careful planning and marketing to the correct groups. This means that one error can derail the entire project. To help you to begin to think through a very complicated process, I offer the following for your consideration. And I want to emphasize that we must undergo this process step by step. The graying of populations in many of the more advanced parts of the world, along with shorter hospital stays, have created multiple new tourism health, wellness, and recovery opportunities around the world, including Indonesia. People in the developed nations may travel to less developed nations that offer top-flight medical facilities as a way to combine healthcare and a vacation. Others from less medically advanced regions or countries may travel to more medically advanced locales to seek treatment not available at home. Some nations such as Brazil, India, Israel, Mexico, and Thailand have developed niche market medical tourism centers. Furthermore, the level of medical care given in a nation may not be related to that nation's economy. For example, medical centers in developing nations often offer private healthcare services that use the most up-to-date healthcare methods and technologies. Many of these clinics offer well-educated doctors trained in the best North American and European medical centers. There is no one formula to help a community decide if medical tourism is correct for it. Some communities have interconnected their local hospitals with other tourism facilities to offer medical tourism packages. Others simply promote good medical prices, good weather conditions, or excellent recuperation facilities. Medical tourism can be regional or international, based on long-range needs or short-range timeframes. To help the people of Bali and Indonesia decide if medical tourism is a good idea for you, I humbly present some of the following ideas for your consideration. Know what you have. Good medical tourism begins with a good community resource checkup. What medical facilities does your community offer? What types of doctors and recuperation facilities do you have? What languages are spoken in your community? How does your climate impact your healthcare abilities? How quickly can you get someone from a local airport to a local hospital or hospice center? How well are your ambulances coordinated with your tourism industry? Make sure that your customer service is top-notch. Visitors who come for medical treatment need extra amounts of love, care, understanding, and compassion. Lack of good customer service can not only harm a nascent medical industry, but also destroy it. To ensure the best medical tourism customer service, take the time to train people not only in generalized customer service, but also in the special needs that a patient may have due to a particular disease. Also take into account that family and friends of patients coming for medical treatment will also need a higher degree of customer service than is often provided. Make sure that your community understands the goals of medical tourism. Often medical tourism fails because the members of the community do not understand its goals and benefits. Locals may have misperceptions of what it means to bring people in need of medical attention into their community. They may not understand that they too play a role in the success of the program, or may resent the fact that their local doctor is now seeing out-of-town patients. Be sure to provide accurate cost-benefit information and work with your community, rather than imposing a new model onto it. Determine why someone might come to your locale. There are a number of reasons why people travel to other places for medical treatment. People may choose to go to another location due to lower costs. They may seek services not available in their home location. They may need to travel to a different location due to denial of services in a managed care or nationalized healthcare program. They may seek to combine rest and relaxation with a medical procedure. And/or they may be seeking privacy. In order to develop a good medical tourism program, it is essential to determine what drives your portion of the market and which of the above reasons may apply to your segment of the medical tourism market. Determine why someone might come to your locale. There are a number of reasons why people travel to other places for medical treatment. People may choose to go to another location. Due to lower costs, they may seek services not available in their home location. They may need to travel to a different location due to denial of services in a managed care or nationalized healthcare program. They may seek to combine rest and relaxation with a medical procedure. And/or they may be seeking privacy. In order to develop a good medical tourism program, it is essential to determine what drives your portion of the market and which of the above reasons may apply to your segment of the medical tourism market. Create recovery packages. For example, does your community offer places where weight loss can occur? Do you have centers where people can go for alcohol treatment? Often, communities have more facilities than they realize but have never combined them in one simple tourism package. Develop alternative activities for people between treatment periods or for their family and friends who may be accompanying them during treatment. Work with restaurants, social services centers, religious communities, and others who can help you combine a total recovery package. Often, smaller communities offer out-of-the-way destinations where people can go for treatment and not be bothered by urban temptations. Develop wellness centers. Nations such as Switzerland have long understood the potential for spas and other wellness centers. Medical tourism is not only about curing people who are sick, but also helping people to stay well. As such, consider combining sports tourism with medical tourism. Develop wellness programs that incorporate your medical and athletic facilities with your community's psychological facilities, its cultural institutions, and its food providers. These total packages offer health benefits to visitors and a new infusion of financial health into the local economy. Simplify your medical tourism package as much as possible. For example, South Korea is developing an island dedicated to medical tourism. That country has also opened one-stop service centers for medical travelers. These centers offer information booths and medical information websites in 5 languages. Even small-town communities can create one-stop medical tourism brochures that provide ideas as to what to do, where to go, and to whom to turn for help. Develop things to do during the period of recovery, not only for the person needing medical attention, but also for his caretakers or accompanying family members. Make sure that your location is not only secure, but also safe. I hope that these ideas will help you, and I very much look forward to seeing each of you on my next trip to Indonesia. I send you much love and caring. Wishing each of you success and good health in 2024. Dr. Peter Tarlow,